Hello, I'm Charles Blair. I want to give you a couple of tips about Dr. Busyness. Dr. Busyness is very important for you to track in your practice. The ideal busyness for the doctor is about a week and a half to 2 weeks solidly booked. Now you might think that busyness comes just from new patient flow. It is true that you need a new patient for about every $4,500 of revenues. That doesn't mean you're doing $4,500 on every patient, but it's just a relationship. So the average $900,000 practice, as an example, would need 200 new patients. But in addition to that is really checking hygiene. And we find that the doctor who is producing more needs also to check more days of hygiene. This is why we see the doctor who is producing around $500,000, $600,000 a year has one hygienist, while the practice that is $1 million a year has two hygienists. So your hygiene days compared to the doctor productivity is very important. A rough rule of thumb is you need one hygiene day per $150,000, or correction, $120,000 of doctor productivity. Now another thing you need to look at as far as busyness goes is the procedure mix. The average dentist does about 90 different procedures. If you're a referodontist, you're doing about 60 a year, and if you are a decathlon doctor, about 120. Now folks, the future is really the profession going over to PPOs. We have challenges for the profession in terms of switching over to PPOs. There's basically two answers to that. One is to use technology better, and the other is to really open up auxiliaries and being able to leverage auxiliaries. So this is the future.